determined by the chairman. Is there proof of publication?
Move to waive the reading.
Yes, the meeting has been properly advertised with Pensacola News Journal on May 1st, 2021.
All right, thank you, Chairman. We have a motion and a second. Please vote by raising your hand because I'm sure this machine doesn't work. That's unanimous. Thank you. Are there any speakers for public forum?
No, sir. Not that I have.
Right. Clara, technical and public service consent agenda.
Thank you. Good morning, Commissioners. Our first is a recommendation concerning the Community Redevelopment Agency meeting minutes, March 4th, 2021, for your review and approval.
Move that we accept the minutes as presented.
We have a motion, second. Please vote. Raise your hand. That passes unanimous. Thank you. Budget and finance consent agenda, Clara.
Okay, under the Budget and Finance, we have 3 agendas. First is the recommendation concerning the Residential Rehab Grant Program funding and lead agreements. There's an A and B for your approval. Number 2 is the recommendation concerning the cancellation of the Residential Rehab Grant Program lien. There's an A and B for your approval. And the third recommendation is a recommendation concerning the Residential Roof Program funding and lien agreement. And there's an A and B for your approval.
Chairman, I have
as
a
well.
question.
Yes, sir.
Have all of the, just to recap and put it on
Yes,
the
sir.
record,
Sure.
have all the requirements been met for item number 2 for that cancellation?
Yes, sir, it has.
100% of the requirements for 100% of the applicants?
That's correct.
Thank you very much. Mr. Chairman, if there's no other questions, I move Budget and Finance consent agenda items 1, 2, and 3 in the affirmative.
We have a motion.
We'll second it.
We have a second. Please vote. Aye. Passes unanimous. Thank you.
And that concludes our agenda for this
Are
morning,
there
sir.
any items for discussion? If not, Mr. Chairman, we stand adjourned. Quick meeting.
Perfect. All right, we ready to go on the video? This is the agenda review for the regularly scheduled May 6th meeting this evening at 5:30. Commissioner Underhill, you have the invocation?
That's correct.
Jeff, can you do the pledge? Perfect. Are there any items to be added to the agenda?
No.
Mr. Chairman, I did have an item. Is it an add-on or is it on the agenda? I'm sorry, no.
There is an item that looks like it was added on item 26. Is that an add-on?
Okay, it's on the revised agenda I have, I guess. Yeah, it's concerning discretionary expense for Northwest Escambia football.
Yes, sir, it's on there. Commissioner May?
Nothing to add, Mr. Chairman.
Okay,
Nothing for me.
okay. I do have one that'll be added for, we got an email about the NISI. Sarah LaFevers was here doing that, so I'll be bringing $1,000 for that. And then also, did the proclamation get out already? That was last night. Okay. All right, that's it for me. Madam Administrator, anything to add?
Wesley, was there anything that you were going to announce this morning, or did you need to talk to Commissioner May? Okay, all right. Amber, were you going to introduce our new purchasing director? Maybe he can hope this is the only time he ever comes to the podium.
For this agenda review.
Yes, for this 5 minutes.
Is this on?
There it is.
Yeah.
There we go.
Okay.
All right. This is Randy Burns. He has over 25 years of experience in the purchasing and budgeting finance field. He comes to us from City of Alexandria as the Chief Procurement Officer, and he is best known for implementing purchasing strategies and bringing efficiencies to the processes. So we are excited to have him.
Welcome. Great, thank you.
Mr. Chairman, if I may.
Yes.
I've had a chance to look into some of the work in Alexandria, and very much look forward to sitting down and talking with you. So if you could, please, before the end of the day, get on my calendar. I'd like to touch base with you about your thoughts, assuming that you had a chance to see it enough to have that discussion. Okay.
Absolutely.
Outstanding. Looking forward to that conversation.
Thank you.
I intend to be educated and put in my place. So, thank you.
A little early for that.
I would never hire somebody to tell me what I want to hear. I only want people around me who tell me what I need to hear. So thank you very much. I look forward to talking to you.
Okay. Commissioners Forum?
Thank you, Mr. Chairman. And I'll mention this tonight as well, but for any of my colleagues that had not heard, I know Commissioner May knew these folks very well, but Christine Alday passed away on Sunday this week. They were, I believe they did some county business as far as photographs of commissioners and things over the years, but for over 40 years they've done, literally they've taken millions of pictures of youth activities in Escambia County, and I would see them, at least weekly in Smokies, if not a couple times a week, and had just seen Christine and Herman in there, less than 2 weeks ago, and she fell ill and like I said, passed over the weekend, and thoughts and prayers go out to Christine's family, her surviving husband Herman, and 2 children, Scott and Darren, that have all been in this Escambia community for a very long time. It's shocking to hear that.
Commissioner May?
Thank you, Mr. Chairman, and Commissioner Berry. That little den room at Herman and Christine's house, I spent many days there taking pictures, and many days taking pictures of my Little League teams that I would coach, and probably Commissioner Bender, in your coaching days of today, if they were around, they would be taking pictures of your team. And when we got elected, Stephen, the first person we kind of met was Christine here taking pictures, and your tie was never right, and she didn't have a problem with getting you corrected, and so it is kind of close to home for the All-Day family, because I truly cared a lot about them. And also to Louise McNeil and to Keyshawn Evans, 25 years old, one of my former ball players. We had to put him to rest on yesterday, and just want to thank the community for stepping up for Keyshawn, and to the Children family. Funeral home with all those who kind of helped out. I certainly appreciate it, and to all those who contributed to make his homegoing something that his family could handle. I certainly appreciate it. So, thank you, Mr. Chairman.
Thank you. Commissioner Underhill?
Thank you, Mr. Chairman. Most of the work that this board has to do up here, we're always focused on the things that are bad, the things that are wrong in the county, because those are the things that require our attention. But this is a county that is truly surrounded by greatness, and I want to take the opportunity to celebrate one of those great organizations. Everybody knows that my son races jet skis professionally. What many people don't know is that he incurred a hand injury in Hurricane Sally, in the recovery from Hurricane Sally, that threatened to end his career as a racer. He had surgery done at Andrews Institute, and then his recovery was done at the Hand Institute, Robert, up in your district, up by the mall. Brett had his first race post-surgery last weekend and came home with a first-place trophy from St. Cloud. There is, the interesting thing about Andrews Institute is that it's the kind of care that is usually reserved for only the elite, and yet here in Escambia County, it's available like literally to everybody of all walks of life. Very impressive organization, and quite frankly, saved a kid's a chance to chase a dream. That's awesome. So hats off to Andrews Institute and to the Hand organization up there. Get a little caught up in it, but watching him, seeing him post that, the pictures of him on the dais and popping that champagne cork and all of that, I thought those days were behind us and weren't going to happen again. So hats off to Andrews Institute for that work. Thanks.
Thank you, Commissioner Burgash.
Well, congratulations, Doug. That's fantastic. news to hear about your son, and I mean, my own Andrew's story, because I agree with you about their professionalism and just what they have there at the facility. My wife had two separate occasions, both knees operated on at Andrews, and both times tremendous outcomes that allowed her to continue to play tennis and do the things that she likes. So we are very fortunate to have that great facility here in the county. Last couple weeks, a lot of big things happening, but I always have to give a shout out to staff because they get beat up. They take a lot of beatings along with us with emails and angry constituents, but we're working on a plan in the western part of my district to eliminate a major traffic issue with one of our hospitals over there, their emergency standalone clinic that's been doing a lot of helicopter transfers of patients. Well, staff is working and in conjunction with West Florida Hospital to develop a helipad there so that they don't have to close down Blue Angel. That's really fantastic news, and so great kudos go out to staff and to the facilities people over at West Florida Hospital. The other thing that we'll be talking about today is alleviating some of their transfer strain on our EMS by doing something kind of out of the box to help them and to help us. So I look forward to doing that. So thanks to staff for that, and I'm sure the residents in the area who are inconvenienced every time a helicopter has to land and transfer a patient, I'm sure they're going to be greatly appreciative as well. Also, environmental staff, Chips Kirschenfeld, Tim Day. For a number of years up on this board, we've been fighting to get more beach access. As a kid, I've told this story over and over, but as a kid growing up here in Pensacola on the west side, we always would go out to Perdido Key. We'd park at the Tom Thumb, or it was a Little General back then, or whatever it was, and we would walk up and down that beach going fishing. And those are some of the best memories I have with my father, who's passed away many years ago. And unfortunately, the Perdido Key has changed now, and a lot of the beaches are not accessible to people like me, folks who didn't have the means to own their own beachfront property or a boat. For me and my dad, the best memories I have was taking a sand spike, putting it, and just hoping to catch a big redfish or a nice, whiting or whatever other sorts of species were out there that we would catch. So with that said, we have had this parcel of property since 2013, and it was set aside for critical beach habitat and also for public access. For a number of reasons, that didn't happen, but this past week I was notified by staff that we got the most important permit necessary for us to complete the project, which was Department of Environmental Protection. They gave us our construction permit. So big hats off to all the staff that have worked this, Tim Day in particular. We've got 100% plans. We're going to have 35 parking spots. We're going to have handicap spots. Importantly, we're going to protect the habitat. We've got the sign-off from everyone necessary. So I want to thank staff for sticking with this project. This board has funded over $200,000 from TDT money. We may need some additional money, but that piece of property, and when it opens, is going to allow my constituents who live in District 1 access to a publicly owned beach on the west side of Pensacola at Perdido Key. And it's going to allow people who don't have a boat or have a condo or have the ability to access waterfront to go to a Escambia County-owned piece of property and go fishing and go hang out. And I just think that's the greatest thing. Brings me back to my childhood, and it's something I've fought very hard for. So I'm proud of what we're going to do out there. I'm proud that we're going to have beach access number 4 opened, 300 feet on the Gulf of Mexico. It's going to be bigger than all 3 of our current accesses combined. In addition, the Crab Trap Restaurant have conveyed to me and others that if folks park in our access area, they will have the ability to use the Crab Trap's 200 feet of beach. So all total, that's 500 feet on the Gulf of Mexico for constituents who live on the western side of Pensacola. So you talk about good news stories. That's a great news story. It's a great news story for West Escambia County, and I can't wait to open that beach access. I'll be one of the first people out there. I can't wait. Big party, coolers, beach access, Perdido Key. Thank you, Mr. Chairman.
I guess I know what I'm talking to Gay Nord about later this morning. Commissioner Mayhew.
Yeah, Mr. Chairman, thank you. And I would be remiss that I forgot to mention earlier in my remarks, Lester Boyd, many of us knew him, that worked in our purchasing department, passed away, and I think his funeral on this Saturday. And so Lester worked real hard in purchasing. Sometimes he was the only one I could get an answer from in purchasing, so we're going to miss Lester.
Thank you. real quick, I want to thank Senator Broxton. Had an opportunity to tour the 3 Mile Bridge and the work being done out there yesterday afternoon. So Senator Broxton's been out there visiting almost every 2 weeks since we had to delay the initial opening back in March. And he was pleasantly surprised to see the progress that had been made since his last visit. They should have just finished the concrete pour of the last remaining sections. I think it was a good night last night. I think they should have been able to do that. And so we do look like we are on track for the end of May to be reopened. Of course, FDOT will have their press release this afternoon. I'm sure there'll be some additional information, but to try to get out there and see the work, I appreciate the senator's support in making sure that we get this open as quickly as possible. And I would say that Skanska's spending a little bit extra money to, you can do that to decrease the cure time. And so the concrete will be cured in a matter of days as opposed to weeks. And there'll still be some work that has to be done to grind it and stripe it and get everything going. But based on what we saw yesterday and talking with them, we do feel that we're optimistic that we can hit that end of May deadline and get traffic moving on the bridge again. So
So is that your deadline now?
that is,
No.
no.
Okay.
I'll believe it when I see it. I did get to see some portion of it yesterday, but we are, again, the senator was very happy to see the improvements that had been made since his last visit. Unfortunately, we did have the accident last week that resulted in a safety stand down for a few days and work being halted. And then hopefully my goal is to have all 4 lanes open by 4th of July and Blue Angels, and definitely something we'll be talking about on our call today.
And Robert, when you say the accident, Mark Carter, who I knew, got hit by a truck. Nefertiti, his niece, has actually been at these meetings, and so we've been working with the family and actually are going to try to do some things for the family this weekend. So to Mark Carter's family, we offer our condolences. And I know that's something that you keep your eye on is the bridge. It's kind of outside my lane, but it kind of hit home a little bit when Mr. Carter got killed.
It just shows how what risk these individuals have every day in being on a construction site, which you're really aware of as well. It doesn't happen just at a bridge construction site. It can be any construction site. So it's, of course, our thoughts and prayers are with his family and also the dump truck
driver family as well, yeah.
Yeah, because that's that's a small business owner in our community that
Made an honest mistake, and I mean,
Yeah.
it's very tragic. But
so. Anyway.
And I do, and as you said, sometimes we beat up on Skanska. I mean, I want to publicly thank them for stepping up to say that to assist the family, and they've made every indication that they're going to provide resources for this family, and so we appreciate that.
Well, good. That's good to hear. Madam Administrator, you have anything? I know we have Marie Mott's here.
Oh,
Unless you
now
have
I see
something
her,
else.
okay.
Yeah.
Yeah, so Marie, if you want to come up, if there's any questions or anything. I know that you all continually do give accolades to our staff, but I just can't tell you how much I appreciate this team that we work with. I think we have a really good team that works really hard on behalf of the citizens and tries to respond to your needs as well. And I try my best to tell them thank you every time I'm with any of them, but I just want to say it publicly as well. It's an amazing team. We've had some good training exercises together, and we're hoping to take that training to their next level, to continue to develop them and their leadership and their abilities. And so, again, I just want to say this personally and publicly again, how much I appreciate them. They truly are the folks that make our citizens' lives better in this community. So I just want to mention that.
Well, that, and I think that, we hope that we can be a place for them to prove themselves and gain job skills or things to make them do jobs. And when they get pulled away to do something better, even if it's at thousands and thousands of dollars more than what we're
Yeah.
paying,
Yes.
we're happy for them.
Yes. Yes, we are losing a very critical member of our team quite frankly, to a SpaceX operation, and that's,
You
how
can't-
do
you
I
can't-
compete
you
with
can't
that?
fault- Yeah.
But
There
we
may
do
not-
wish.
There may not be enough money
Yes,
to do that,
yes,
so.
but I just want to tell them how much I appreciate them. Someone in IT. Mhm. Not the director, but someone in IT.
Morning, Marie, how you doing?
I'm doing well, thank you. How are you?
I'm doing fine, thanks.
Good.
So just want to get a quick update, and go ahead.
Sure, I'll go through a couple of things. Again, I brought a lot of references. I don't need to necessarily go through all of these unless there's questions, but something, relevant, at the end of April, the Surgeon General issued a new public health advisory, and basically making vaccine eligible to not only Florida residents, but to those individuals present in Florida for the purpose of providing services or goods that benefit residents and visitors. So that just kind of expands capacity to vaccinate people. Additionally, that advisory stated that to encourage government offices to begin conducting in-person operations and services again. And I do have a little bit of case data. I don't know if there's any questions about cases in the county right now. We can kind of see the bar chart there that has the daily returns of positive cases, and the percent positivity, I believe, is on this slide here. So again, hovering in the upper half of the 0 to 10% kind of section of returns on tests.
Marie, can I ask you a question on this slide? The 18-year-old and under pediatric testing, you've got a 13.4% positivity rating, 3,202 positive cases. Do we know how many of those were asymptomatic?
No, I don't. I don't have that data handy. There is a school report on the Florida Health COVID website,
Yes, ma'am.
and that doesn't always match completely the data on the pediatric testing, but they do note if there's any symptomatology on that report.
Okay, thank you.
And is that for the time frame listed above? Because, I mean, I believe we only had 3,500 tests done in the last week.
Yeah, this is cumulative
So this is cumulative from
from about last year.
last year. Okay, I think that's important to note that we haven't had 3,200 positive cases in the last 2 weeks or any, I mean, I know our
Correct,
numbers are
yes.
well below that, but is there I mean, are we able to get data on that for the last 2 weeks? Thank you.
So by age group, you can kind of see a little bit of that. And I did put the red circle on there just to kind of see, those are the new cases, so it's easy to follow there. And you'll see, that under 55 grouping is definitely higher than that 55 and older. And you can see those pockets in that 25 to 34 age group being the highest.
And this is the single day, so this was the
That's the-
last day we had
yeah.
data for, which we had 29, which it looks like our new cases by day has fluctuated above and below this number, by 20 or so. Go ahead. Anything on this one?
Maria, I mean, are there any indicators through the contact tracing that shows why we would have the influx maybe in the 35 to 44-year-olds and 45 to 54? Or
Not
is it just
necessarily.
that many people are just testing, more people of that age group are testing, or what's the reason
Yeah.
for the higher percentage?
Not necessarily any type of indicators there.
So you still do contact tracing with this, or?
Yeah, we're still contact tracing our positive cases, definitely to try to encourage prevention of spread, and also, to make other potential cases aware of if they need to get tested, if they need to watch for symptoms, those kind of things.
Well, I think that maybe the 25 to 54-year-olds are probably out more, maybe in nightclubs or something. Yeah.
Okay. Commissioner Andrew, sorry, did you?
Thank you, Mr. Chairman. On tangential or related to this subject, our bases went to HPCon Bravo on the 3rd. What that means for us is that we'll start seeing sailors out in town a lot more. They can start frequenting places like barbershops and all the businesses in Warrington that have been struggling through that loss of business. It does not mean that on-base tourism-related facilities are open yet, but it is a step in the right direction. It's a recognition on the part of Navy Region Southeast that controls our bases that we're moving back toward normalcy. So as soon as the base and the military can determine that the influx of visitors to places like the museum and the lighthouse are not a threat to our missions, then we'll be able to reopen those facilities. I get a lot of questions about when those are going to come open. So our movement toward HPCon Bravo and establishing HPCon Bravo on the 3rd is a massive step in that direction. It's the first positive step in that direction since it closed. I'll bring that information back to the board as much as I can as we advance those discussions. What it will see, you'll see some changes in traffic patterns in Warrington, and you'll start to again see sailors out in the community again, which is a part of our DNA here in this town that it's been woefully absent for a year now. So good news stories on that side.
Definitely.
Commissioner May?
And so on this slide, Maria, we're at 37%. Is there something we can do to help increase it? I mean, we're a little down from the state average, and is there a local goal that we're trying to get to? I mean, I know we hear a lot about herd immunity and those type of things, and to make the community safe where people can move about. Is there a targeted percentage that you kind of have on your mind that we should be shooting for?
Yeah, this slide kind of just demonstrates where we are with vaccines through the data that was available yesterday. And yes, we are below the state average for individuals vaccinated that are eligible. And that's one of the things we'd like to see change. I know back at the end of March when we were looking at the possibility of vaccines opening up to all age groups or to 18 and older, I talked with the community partners that are providing vaccine, and we had kind of looked at the capacity and where we would hope to be and kind of set a local target of trying to reach 175,000 vaccinated by the end of May. Again, that's based on what we could vaccinate and if we could get vaccine in, because we were still in a very limited supply situation then. And so the supply has opened up, but it appears that the demand is being maybe not as robust as it was back in January, February. And so that's kind of where we're trying to get messages out to encourage people to get vaccinated.
Are you running vaccine clinics, or is it just kind of partnerships now?
Well, so we have clinics at our Fairfield facility. We are wrapping up the big site at Brownsville this week. The demand there has waned quite a bit. And then commercial pharmacies, just about any of them, larger pharmacies are offering vaccine, sometimes in a walk-up situation. I was in Walmart this weekend and, shopping, and I heard over the loudspeaker that you could go get a vaccine right then and there. Also, Community Health, Sacred Heart, Baptist Hospital, West Florida, and some of the smaller practices are still offering vaccine as well. So it's pretty widely available. I think it's getting people to decide to go ahead and go get it, or that the time is right to go get it, or even just aware that it's available. So one of the things we've done is initiated a media campaign, and I did bring one of our assets in to show if it'll play.
And this was something that we discussed on Monday, but let's go ahead and hear this one.
Yeah.
COVID-19 has made a big impact on all our lives over the past year.
Together, we can lift the burden and help stop the spread of this virus.
Vaccinations are here and are safe, effective, and save lives.
All Floridians are now eligible to receive the COVID-19 vaccine.
It's your turn to protect yourself
and your loved ones by getting vaccinated.
You play an important role in this monumental effort.
That will help us return to normal.
COVID-19 vaccines will help protect us from this deadly virus,
so we can get back to the people, the hobbies,
and the activities
that we all cherish and miss.
I got vaccinated for my community.
I got vaccinated for my family.
I got vaccinated for you.
Now it's your turn.
It's your turn.
It's your turn.
Pre-register at myvaccine.florida.gov or by calling 866-201-1025.
Remember, don't wait, vaccinate.
Don't wait, vaccinate.
Don't wait, vaccinate.
Don't wait, vaccinate.
Thank you, and so this was a major topic that we discussed on Monday in our meeting, was that our healthcare providers have done an excellent job of securing demand, or supply rather, but the demand has waned. I think I looked at it quickly. In terms of population size, we're about 22nd in the state, the county is, and right now we're about 26th, 27th in terms of number of vaccines given. And so we have availability. As I said, there are some of them are walk-up. We were going on and checking online during that meeting where somebody could get one within 2 hours. We've seen it, and I don't want to say it's just Escambia County. I know a number of weeks ago, Sacred Heart pulled their vaccination center in Santa Rosa County because they were having such low numbers that they could just absorb them into what was going on at Olive Baptist Church. And so we wanted to focus on getting that message out, that it's availability. We continue to look at pods or all other sites that are more easily accessible or fit better with people's schedules. We've started using the J&J is starting to be used again, so the people that want just the one shot and be done, that is available. And so I would say as we see our community reopening, we're getting into the summer, we're going to be out more, that we want our recovery to continue, and we feel the best way to do that is through our community getting vaccinated. Because if I were someone going to visit an area and there's data and I can show what percentage of that population is vaccinated versus another percentage, that may sway my decision on where I want to go. And so hopefully we can show that we're taking those steps to have community vaccinated.
Marie, if I might, just a couple quick questions. There's some folks who, for reasons, for different reasons, various reasons, they don't want to get vaccinated, and that's contributing to the vaccine hesitancy. But let me ask you this, though. If for those of us who have been fully vaccinated, myself, I've had 2 of the Modernas, so I'm fully vaccinated. I see folks that are fully vaccinated continue to wear a mask. I don't understand that. Can you help me understand that? Because once you're fully vaccinated, why would someone still wear a mask?
Well, that still is the CDC recommendation, so that's kind of the bottom line. In most cases, to continue to wear a mask, there are some changes in that have come out lately, but until we really have a better understanding of the virus, how it operates, and how the vaccine in the long term operates when boosters might be needed, prevention practices are still important.
But if you've been fully vaccinated, you obviously, you're protected. So I guess I just don't understand the logic there. But
Jeff, let me help you, because I still wear a mask. And
Yeah.
Just because you take a flu vaccine doesn't mean you didn't get the flu. And just because you take a COVID vaccination doesn't mean you're not a carrier. It means you don't get as sick. And nor does it mean that you can't spread it. You can still get COVID even though you've had a vaccine, and you can have.
I don't know that that's the science.
That's the science it is.
If you've been vaccinated, you're not going. You don't. They say it's effective 95%, 94%.
It's effective for you not getting sick. It's not effective for you not carrying the vaccine. That's data.
Well, I guess I just don't.
Yeah, I don't want to fight with you on the science, but it depends if you get it from Fox or CNN, I guess. But I can just tell you, the Center for Disease Control and all of the scientists will say taking the flu vaccine doesn't mean you can't get the flu.
Yeah, but this we're talking about these vaccines that are 94% effective. I guess I just don't understand, and maybe I never will. But
none of us will.
If the vaccine is truly effective, and we have a hard time getting the population as a whole to buy into it, the governor has just recently opened up the state again, and he's, eliminated the mask mandates or any kind of penalties and stuff like that. So, to me, it just seems like common sense. If you're an adult and you don't want the vaccine, and those of us who have been vaccinated, we ought to be able to open up. And I see the slide. We're still talking about the 6 feet of social distancing. I guess, again, if the vaccines are truly effective, all of us have had access to them, is there any reason why we can't fully open up 100% from a scientific standpoint if the vaccines are truly effective?
I kind of feel like that's two different questions.
There's several in there.
It's all political, Maria, that's why I'm answering them for him.
But-
Yeah.
But, again, the CDC recommendations are still promoting prevention practices, and that's kind of where I'm going to stand at this point.
Even in theory, Maria, if the vaccine kept you from getting COVID, which it doesn't, it protects you from getting sick from COVID. You only are at 37% of the population in Escambia County that has it. So you still have a tremendous amount, Jeff, of the population that's at risk of getting sick because they, for whatever reason, have not taken the vaccine.
Well, I mean, I guess I look at it more optimistically. I mean, we've had a tremendous number of people who've had the virus and recovered, and so they, purportedly have the antibodies, and then there's a significant number that have been vaccinated. So, when we talk about getting to the herd immunity, is that, you listen to the very intelligent people who don't believe it will ever get there. Do you think we can get to herd immunity with the small number of people that have been vaccinated?
I mean, the bottom line is that this is a novel situation, and we're learning more about it every day. And what we need people to do is to get vaccinated and to continue, wash your hands and stay home when you're sick, practice those prevention methods.
And if you're fully vaccinated, but you still advocate wearing the mask even if you're fully vaccinated?
She has one on.
I mean, I guess I just don't understand. I guess maybe I never will. I mean, once you're fully vaccinated, are you saying I could still have this disease? I'm fully vaccinated. I could still have it, so I should wear a mask?
So my understanding from the studies for the authorization is that they were studying illness after the vaccine. So we're still learning about the ability to transmit after the vaccine.
But hasn't there been just only 5,800 breakthrough infections nationwide? I mean, it's such a tiny, minuscule percentage of 1% but you don't know. So I could have it, even though I'm vaccinated, I could still have it?
That is a possibility.
And then I could transmit it,
That
but
is a
not have any
possibility.
symptoms? Okay.
Until we know more. So right now, like I said, it's a novel disease. It's been around just over a year. And, we're learning more about how the vaccines are
And I'm sorry
operating
for the
within that
difficult questions,
disease.
but I don't get to talk to, the director of the health department very often. So I always want to ask these questions because constituents ask me these questions. So, and to me, they're reasonable questions. Thank you for being here.
Sure.
Okay. Anything else?
And Jeff, those are very reasonable questions, and I probably would never agree, but, I mean, the data has indicated we continue to have deaths every day in Escambia County due to COVID-19. I mean, so it hadn't stopped. Positives have not ceased, nor have deaths stopped in Escambia County. So if I would err on the side of safety, so to me, that's a personal choice, and that's an individual right. I mean, it's just like smoking. I mean, you have the right to smoke. You just don't have the right to smoke in a building and put your secondhand smoke to me. I mean, you have the right to drink. You just don't have the constitutional right to drink and drive, and you have the right to not wear a mask, but you certainly don't have the constitutional right to endanger my life because you have a virus.
All right. Thank you.
Thank you.
Okay.
The only thing, I'm sorry, I did want to ask Marie. Marie, if you don't mind, I know that Laura, we have had some questions about, you do have funding for advertising. Are you getting this from the state?
The funding we're using for this campaign is funding that I've diverted from my other messaging
Okay.
campaigns within the health department.
Okay.
We are looking for more funding for vaccination messaging.
Okay. And I know that we work really, really closely with your team. So we'll just have Laura continue to talk to you maybe about ways we could continue to partner.
That would be great.
Okay.
Thank you.
Thank you.
And it'd be great, Madam Administrator, if we would put some of those energies and resources into some of the at-risk and underserved.
Yes, sir.
For that.
Yes, sir. Thank you.
I'm sure y'all probably talked about it on your call.
We did. We looked at, you have some county data there. There's, of course, some smaller counties that have done just as many as we have. But they also have it seems they've done a lot more over 55. So you wonder, so we've done more of the under 55. Maybe we just don't have that as many older population as they do. But yes, we definitely talked about ways to get into all parts of our community and. Appreciate it. Thank you. Okay. So proclamations, we have, who's, all right, I'm not skipping anything here. Captain Turpin, you're going to be presenting the Marine, you're going to do certificates of appreciation for the turtle nesting this evening. And we have our employee of the month. Commissioner Barry, are you going to do the Don Sutton, or is that?
Absolutely, please.
Thank you, sir.
Yep.
Who's doing C? Is that? Right. No. Oh, I thought we have, sorry, Emergency Medical Services Week. I got to update this one here. Hold on. All right, so I'll do the National Travel and Tourism Week, Emergency Medical Services Week. Is that one of us, or is that going to be, it'll be two public service director? Who? Billy Ship, okay.
So for emergency medical services, if one of you want to present it, there will also be representatives here from the hospitals and other entities to join Eric and Billy and them.
Anybody else? Or you want to do it? Okay. Commissioner May will do it. Commissioner May, you want to stay down there for Emancipation Day? We have,
CAPC?
yep. And then we're ratifying two others that were already presented. Okay? Thank you, Commissioner May. Do the clerk's office read the proofs of publication?
Mr. Chairman, the clerk's office has received all proofs.
Great, good to hear. All right, we have 531 public hearing. That's in my district. 532, vacation right-of-way on Pelham Court. Commissioner Underhill.
Yeah, since these are public hearings, not much to talk about
Yep.
on them outside of them, but the next two are in my district. The backup, I think, is all self-explanatory.
Perfect.
Yes, and Stacy Coker did send to you all a list of comments that she is getting from the public. So she did provide that to each of you.
Thank you.
And 533, also vacation. Clerk's report.
Mr. Chairman, the clerk's office has one routine item for approval tonight concerning minutes and reports prepared by the clerk to the board's office.
Great, thank you, Tammy. Horace.
Yes, sir. Good morning, Chairman, Commissioners, and board members. For tonight, for the 545, we have 545 public hearing concerning the vested rights determination 20-21-01. Then item number 2 is a 546 public hearing concerning vested right determination 2021-02. Then we have our growth management action item, final plat for Caeli's Landing. And we have the final plat action for Bridlewood as well. Then we do have the GMR consent agenda, which I believe there are going to be some changes.
Commissioners, I just ask, as I did in my previous email, I need you to please withhold from this item 3.1B, which is just dropping the scheduling of the 9/16. We'll be circling back with you. There is some relevant litigation associated with this matter.
That's in my district. I'm supportive of dropping that for the day, for the reasons that the attorney stated.
All right, so can we go ahead and take that as a decision this morning and then not, or will we have to do that this evening as well?
You can indicate to yes. This is not yet advertised as anything, so
Okay.
you can just amend it verbally and in your vote that you're withholding B tonight.
Okay.
So the motion should just be for the consent agenda items A, C, and D, and that'll cover it. Got it. Thanks.
Okay, and then north-south head nods from the clerk.
I did, Horace, since our last meeting, since Monarch was such an issue and we have had a considerable amount of rain, would you please give the commissioners an update on the status of that particular piece of property?
Yes, ma'am, I will. we have been working aggressively and assertively with the developers of the subdivision. Mr. Kevin Blanch, who's been on site, not every day, but been reviewing the site to make sure they get up to compliance with the construction plans. The notice of violation was given to them. It was, and they did pay their fines on that. They are in the process of yet constructing and following the construction plans for the site. There have been some concerns over some of the citizens who raised some concerns about the noise. We spoke to them about that based upon what the development order said. There was some concerns about the hours of operation. The development order gave some explicit hours of operation. We spoke to them as well on that. Now, there were some concerns also too about speeding.
Right.
About speeding, whether it was coming from them or not. But we did speak to them about that as well. Also too, and you may, and I just would, yesterday afternoon, I'm making this for the record, yesterday afternoon after work, I did go by the site like I try to do at least twice a week to see how the site is looking. And when I left the site, as I was leaving Monarch Lane, I got a chance to speak to Mr. Thomas Holmes. Someone had sent a picture in this morning indicating that I was talking to Mr. Thomas Holmes. But he pulled to the side and I was able to talk to him. Yes, I did have a candid conversation with Mr. Thomas Holmes on yesterday afternoon as I was leaving the site. He was on the side. I guess he recognized my car. And he said, Horace, and I stopped. We talked frankly about what occurred, about his responsibility to address any adverse impacts on the surrounding properties. So someone took a video of me talking to Mr. Thomas Holmes on yesterday, and they sent it in, so y'all may see it. But yes, admittedly, I did talk to him yesterday afternoon, and we had a very candid conversation.
Okay. I think one of the main things that we wanted to make sure was that the residents have had communications with the developer in response to their concerns, because
Yes,
that piece is a private matter, but we want to make sure that we were very clear that we wanted that to take place.
Yes, ma'am. We have been through emails. I spoke directly to Joe. I told that to Mr. Thomas yesterday. So that information has been relayed to them. That is a private matter, but they definitely need to be engaged and try to rectify and address those citizens. Yes, ma'am.
Okay.
Horace,
Yes.
candidly, concerns and compliance are two different things. I mean, it was a concern when the order was issued. Who reviewed, approved, inspected the construction plans?
The construction plans was reviewed by, the construction plans, when they submitted construction plans, it was reviewed by our staff. They met on the construction plans as submitted, and it met all of the regulations. It met, and that's why it was, that's what
So
it
the
received.
pathway for implementation was adhered to, is what you're telling me, or someone's gonna tell me that who works and who's willing to put their job on the line.
Well, they are willing, they met the requirements of the Land Development Code for construction plans preliminary plat approval. There were some violations. And we spoke to them about it, and they began to move with corrective action. But the construction plans and the development and the preliminary plat was approved per the requirements of the Land Development Code.
And maybe this is a Joy question, because this just really rubs me the wrong way. Are there still drainage issues there? I mean, those citizens were concerned, and we approved something, and we assured them that there'd be no adverse effect. And obviously, there's adverse effect for those citizens. So are there drainage issues out on Monarch?
On Monarch or on
Yeah.
the development? On Monarch because of the development.
Is there a draining issue?
There are drainage issues on Monarch because they don't have a system and they weren't required to put one in when they were developed.
Because of the developer that's doing it now?
What the
But
developer,
who's not required to put a system in?
the developer is required.
I mean, he didn't, is what you're saying.
He didn't have them in yet. So he's working to put them in, and they're required to meet the 100-year storm.
So there's no drainage, public issues that we need to address as a county?
There is in the old neighborhood, Monarch. They
So,
have- they have some
let me just cut
issues.
through the chase, Joy. Here's the deal. We approve something on this board that adversely affects the citizens. I don't care what it costs, bring forth whatever the engineering plan is to make sure that those people are not flooding. You know, I don't care what it is. It needs to be brought forth ASAP, Madam Administrator. We sat here, people came down, people were brought out to a public meeting, and they were assured by staff and by this board that they were going to be safe. And now I have signs going all through my district and my neighborhood of people being flooded on Monarch. And you know what? I'll take the brunt of it. I'll take the responsibility because I have the authority. But the authority is, Madam Administrator, I'm directing now that engineering brings back a plan that these people are not flooding. Period. I mean, there's no excuse that there's no money, no time. It needs to be brought forth now because those citizens were adversely affected by a decision that was made at this board. So, Joy, not jumping on you, please bring that forward.
Yes, sir.
Mr. Chairman, if I may?
Yes.
Commissioner Mayor, there was no flooding on Monarch before this thing was done, before this.
Well,
developed.
that was my understanding. Now I'm understanding that it was drainage problems before this development was. Well, I'm not an engineer. I don't approve plans. I only go on the best knowledge that I was given.
Okay.
There was no indication to me that it was flooding before this. But now I come to understand that maybe there was. Is that what I'm understanding, Horace? There was drainage issues before this development?
They don't have a system in place. What they had were
That's not the
roadside
question.
swales that over the years have been filled in with their sod in their yards and those kind of things. So at the time, that's the system they had.
Okay, well, it's not really an answer. The question is, were they flooding? Were the houses and yards flooding? Okay, so.
If it was, it's a problem, and if it is, it's a problem.
Yeah, either way, so, but my concern is about where is the public burden of the financial burden. So if there was flooding issues there before that we should have taken care of, then certainly that's a proper expenditure of our dollars, of taxpayer dollars. But all of the bad results of the contractor need to be on the contractor. So, I'm very supportive of getting it fixed. I really would like us to get to a point where we truly analyze what the stormwater conditions are going to be. And honestly, Lumen, when I look at this one, I don't trust that even when the stormwater project as the stormwater amenities of that neighborhood are done, I don't think they're going to solve the problem. They appear to me to be considerably deficient. Now, I'm more accustomed to the southwest sector, which is always a swampland anyway, and so drainage in my neck of the woods is always bad. But it just seems to me that you're right in that, and you have my support to get done whatever's necessary for those houses not to flood. But I just want to make sure that we don't end up spending taxpayer dollars to fix the sins of the developer that should have prevented this the whole time.
And all I can do is ask the question, Mr. Commissioner, because I'm not an engineer. I know that this was a very sensitive issue for those citizens, and it passed all of the zoning and whether it was permitting. And I was led to believe that it wouldn't be an adverse condition for those citizens, and it has been.
Yeah, no,
and so I take responsibility when I make a decision.
And the citizens begged us not to do it.
Absolutely.
So,
and that's why I'm going to take leadership. It's not about them putting out signs in the neighborhood. It's not about a vote. It's about doing what's right.
Yeah, but
And those citizens came down. Unfortunately, they came down to chastise me even before this development started. And we had to go by the land development code about what the law permitted. But had I had anyone to stand up to that dais and tell me putting in this development is going to adversely affect those citizens, I would have been yelling, screaming, and saying, I don't care what the code says, we can't do it.
Yeah, I think that moving forward, the burden of proof has to be on the developer that they're not going to be the next Monarch Lane. But like I said, as we move to fixing the 5-meter target, the immediate problem, I just would like to be very cognizant of where the blame lies and make sure that the check, that the bill is picked up by where the blame lies.
Let me be candid, because I'm not anti-development. Let me tell you, urban development is a lot different from rural development. Right. I mean, you can go up on the north end and do a lot of things that you can't do in an existing neighborhood that has an existing draining system. So the only complaint I received when they came down was the increased traffic that was going to be in their neighborhoods to this development. I never had a flooding complaint. Now I have a flooding complaint. And so it leads me to want to figure out, without standing and talking from the dais, for my staff to tell me exactly where water comes from somewhere. And they got engineers and calculators that can calculate that. That's above my pay grade. But somebody can figure that out.
Well,
That makes more money than I make.
And we've got the floods of 12 and 14, and we've got the flood of the flood related to Sally. We've got a good pattern of data to answer the question as to whether or not Monarch Lane had a flooding issue prior to this development going in. And that's, that's not
we have
hard for our
money.
GIS guys to put together.
Yeah, bring that data.
Yeah.
You know what I mean? It's cutting, I mean, it's plain some.
In Monarch, they didn't have home flooding, they had yard flooding and street flooding. So.
Before.
When it rains, right, when it rains, they don't have a subsurface system, it was surface system. And over the years, those swales have been filled in. So there's more water pushed to the road and in their yards and in their driveways. But I'm not aware of any home flooding inside the home.
Okay, well,
Now-
we've got great inundation maps for those three major events that I talked about. And I think if you take those three major events together, you can see where your inundation issues were. We deal with that in District 2 all the time because, quite frankly, we're inundated most days that we're. So, I'd like to see that. And I think that Commissioner May needs that information to be able to properly assign blame, and I think this board, not blame isn't really the right word, but assign responsibility. This board's going to follow where the commissioner from that district leads, and I think that it would not be too much to ask.
Right.
To see those inundation maps as a part of that discussion.
Absolutely.
Thanks.
Bring the data.
I
If it
will
was
get-
flooding.
I will get those.
Yeah, bring it.
The contractor didn't follow the rules, though, when he was developing, and that caused the major issues recently. He didn't build his pond, he didn't, rough it up so the water would go there. He didn't even have the pond. So everything ran off into that neighborhood.
And that's the reason we have permits, and that's why you have inspectors. I mean, if he's violating, guys, we just don't wait until, it rains and then people begin to flood. I mean, we stop him when he's doing it, and so, I mean, that's, I don't know. Just bring the data, rework the swales, stop their flooding.
Perfect. Thank you, Commissioner May.
Madam Administrator, are we pretty good that we are going to address all of this for the people in Monarch? Because I appreciate Commissioner Underhill and has been very passionate. Doesn't matter to me whether someone votes for me or not. I have the responsibility to advocate for the citizens in my district. And this is a major problem. And very rarely do I stand on this dais and say that there's a major engineering, flooding, development problem in my district. It's probably only the second or third time. This is a major development problem in my district.
All right. County Administrator's Report. We just run through these. We have the CRA meetings, minute meetings from March 4th. We have 2, 3, 4, and 5 are disposition of property for corrections, public works, elections, and neighborhood and human services. 6 is a recommendation concerning the interlocal agreement with the Santa Rosa Island Authority for mass transit beach trolley service. 7, concerning the Florida Uniform Waterway Marker Permit within Bayou Garcon. 8, concerning the Department of the Army permit for nearshore east and nearshore west artificial reef. 9, recommendation concerning the U.S. Board of Geographic Names approval of the name Inverary Point. I saw this and thought of there 2 O's in Goose. Right, all right, okay. So we need to make sure that second N's in there. Recommendation concerning the interlocal agreement between Escambia County, Florida, and the School Board of Escambia County. Again, this is trying to get some more EMS and get that pipeline going, so looking good to have that. 11's a corrected Scrivener's error from card 2-13 from March 25th. 12 is concerning the conveyance of property to DOT. 13's conveyance of a temporary easement to DOT. 14, recommendation concerning authorization to obtain title insurance on county-owned property. And I think this is just when we need it. We don't have anything specific now, just that when we're required to get it, we can get it. Budget and finance.
15, your letter?
15 is my letter. It's just the same thing that Commissioner Berry signed as part of the TPO, and that we've also sent to our neighboring agencies. So thank you, Commissioner Berry, for taking the lead on that. We hope that the state is able to authorize this.
Hey, Robert, let me ask you a question, because I know you've been following and leading on that. So the folks that own that bridge and the governor lifts the tolls, are they, it's hard to feel sorry for them at $5 a toll or whatever, $3.50 or whatever it is, but are they going to get paid back for all this? I mean, are you aware whether or not they're going to get at least some, because there's a cost associated with the.
I think there'll be some arrangement worked out. So.
Who's going to pay? Is Skanska going to pay, or are the taxpayers going to pay?
I haven't been privy to that. Those haven't come to our level yet. I think we'll work it out on the back end, and so I think there are a couple of different things that are in play, but we'll have to see what the legislature can do and come up with. I know that Representative J.R. Williamson is really taking the lead on that, and I haven't necessarily talked to him about it, but I know it's something that he's working on, and appreciate his efforts on that for everyone that has to do it. Budget and finance. One is a rehab grant. 2 is the cancellation of rehab grants. 3 is residential roof program agreement. 4 concerning amendment number 1 is CDBG amendments with legal services in North Florida and the Council on Aging.
Mr. Chairman.
Yes, sir.
Claire, a quick question on the title clearance. Was that we're finding a lot more title problems, or are we helping more people? Because I know that's probably a problem. A lot of people in my district are losing their property because they can't get their titles cleared. Is this helping that, Meredith?
I'll let Meredith speak more onto the details.
I mean, it's good. I'm glad to see it. I'm just wondering, are we helping more people clear up their titles?
We definitely, they do. I can give you the reports from the last years we've been doing this contract with them since 2016. We definitely are seeing a lot more referrals, so I do think there is an uptick in use for their services.
Is that why we increased the funding? Because we had more
So
titles to clear?
part of the increase in funding is, we are behind in getting our 2020 CDBG funds. So typically we provide them with more of a contract. Usually the title clearance is $60,000 a year that we appropriate, and for Council on Aging it's $45,000. So this is really to try to get them, kind of tide them over until we get the 2020 CDBG funds, which have been delayed due to COVID.
Okay, thank you.
Yes, sir.
Thank you, Mr. Chairman.
Thank you, sir. Okay. 5 is concerning the Escambia County Summer Youth Employment Program.
Mr. Chairman, I'm very supportive of this, as you know, and I want to encourage our department directors that have not participated to participate. I think we're probably up to about 11 young people who now have permanent employment with the county due to this program, and so sometimes it's easier not to give opportunity. So I certainly encourage departments to give young people an opportunity, and it's disappointing if people don't give young people an opportunity, because this is a very important and successful program.
I think so. It's great. I know that we've had some very successful stories come out of this, and
absolutely.
So,
well, we just love to see all of our departments, because quite frankly, many of the young people are never exposed to things that we take for granted, IT and different departments that they don't get in career exploration in high school. And so from administration to our attorney's office to our parks and recs, I mean, I'm grateful for those who have participated, and let's continue to give young people an opportunity. Thanks, Mr. Chairman.
Thank you for your leadership on this, and I'm always happy to support it. Commissioner Underhill?
Thank you. Commissioner May, this is, you see the ones that actually end up have full-time jobs here, and that's a part of the good news story. But I know that over the 6 years, every single intern that I've had has changed their life plans as a result of what they learned here. So, it expands their horizons, and with expanded horizons comes expanded opportunities. I won't necessarily say that all those changes are for the best. I mean, maybe it actually creates a little bit of cynicism. But cynicism, when input and when cycled through a mature mind, becomes a basis in truth that makes them better citizens all the way around, whether they come to work for us long term or not. So, the more that we can expand that, and I want to just reiterate what you said to the department heads. If you can bring a young person on using this and it creates a 5% increase in your level of effort, then that is some of the best investment you will make with your time during your season of service working for the county. So I would hope to see departments leverage this, and competing with one another for the applicants that we have. Thank you.
No, and thanks, Doug. I mean, I think two of the things that when I first got elected with Commissioner Berry and I was one that was the intern program that was important to me because I had the opportunity to not be paid by Commissioner Junior, but to at least get exposed to being a part of what you do as a county commissioner. But the other is the summer youth employment program. And so we talked a lot in our other meetings about sign-on bonuses, and we can't find enough people. This is a way to grow your own, train your own, and you don't even have to give them a signing bonus.
They'll take it. They'll take the signing bonus.
Oh, yeah, now that's a good one, right? Yeah, they will if you give it to them. Yeah, they will. But hey, we're investing. We're investing in you right now. I mean, that's what we're growing our own, and the best way to keep young people here in Escambia County is to expose them. As Doug said, this may be just something you realize you don't want to do, but at least you've had the exposure to it.
That's always part of it.
Yeah, spending one day in my office, you realize you don't want to do this.
But Commissioner, then that's the cynicism part, but then at the same time, I also find that those young people who actually understand what it takes to provide government services, they're not nearly as aggressive on social media later on, because they understand how hard this actually is. Well, why can't we just have this? Well, because of due process. Oh, okay. And I think that the more of our citizens who understand the constraints on government, the appropriate constraints that exist on government, the much better we are as a society. So yeah, I've seen no negatives from this program. Nothing but positives. I'm looking at Connor, so I mean, you were still holding out for you, buddy. So no, a rock star example right there.
You and Commissioner Berry have both made all of your interns. It's great, and Doug, you and I, somewhat agree a lot on economic development. To me, this is the best economic development you could ever do. These are jobs I can see, touch, and feel, and I know that they're being created.
Yeah, I'll take any amount of this over when we talk about in terms of economic development.
All right.
Because you're just investing in your workforce. That's all it is. I mean, it's pretty simple.
6 is concerning the Sea Turtle Conservancy Grant Agreement. 7 is a contract award for the Pensacola Peter Bay Estuary Program Trash-Free Waters Services. 8.
Mr. Chairman.
Yes, sir.
Yeah, if you don't mind. I don't know if Chips or Matt or whoever contact person is for this. Hey, Matt. How you doing, buddy? Hey, so this Osprey initiative.
Yes, sir.
So they were the only respondent to the procurement.
They were.
Why would that? Is it a really specialized whatever they're doing? I just don't know much about this stuff.
Yes, sir. Matt Posner, Natural Resources Management. It is a specialized field. Osprey does a lot of work over in the Mobile, Fairhope area. They actually developed much of the technology for the litter getter collection devices that we're looking at. There is only one other firm that I'm aware of. They operate in Tampa, and they did not submit.
Okay, thanks.
Thanks.
All right. 8, concerning supplemental budget agreement 087 for fiscal year 2021, reimbursements to Law Enforcement Trust Fund. 9, concerning supplemental SBA 93 for fiscal year vehicle auto auctions. 10, SBA 89 for investigative funds. 11, SBA 94 for reimbursements. 12, SBA 99 for reimbursements of anticipated investigative funds for the remaining fiscal year from the LET fund. 13 is the Edward Bryan Memorial JAG program. Fourteen, concerning the contract award for GPS monitoring with Attenti. 15, concerning the issuance of a purchase order to Worldwide Technology for the F5 Networks LTM upgrade project. 16, concerning notice of grant award, DOT. 17, concerning acceptance of fiscal year 2020-2021 Escambia County expenditure comparison summary by fund report and community partner reports for the second quarter. 18, concerning roadside litter pickup.
This is a big one. Janice, will you go ahead and describe what this is going to do for each of us in our districts? This is really a good news
Yes, sir.
story. Hopefully,
Yes.
the media will pay attention.
Well, sir, you know, you all have been very concerned about the issues related to trash and, following the hurricane. And so we put together a strike team internally to try and come up with several different ways to try and assist you all and try and assist our community in looking better. As many of you know, we have had, unfortunately, a reduction of the number of folks that are eligible to work on the roads from our road camp. And so we are having to, get outside help. And I do think, quite frankly, this is the most affordable option. The good news is we already have a pre-existing contract, so we do know that these folks do provide good services. They are a nonprofit in our community. We do have a funding source, which is our waste management source. Yes, solid waste. And then we also have the situation where West Marino and the road department, they clearly know some of the hot spots, but of course they'll also be communicating with each of your offices to make sure that we're hitting hot spots in each of your districts. So there'll be 2 crews covering each district 1 day a week. And that's currently the contract is from now until October 1st. And then we have already planned this to be in the budget for next year, for the next fiscal year.
That's a great question, but anything from where we're at right now, if not, yeah. Well, the baseline is, unfortunately, people litter, and it's horrible when you drive through Alabama, parts of Alabama, and it looks pristine on the side of the road. You get into Escambia County, and it looks like a dumping ground.
No, it's horrible. No, Jeff, I support it. It's horrible.
People have no pride in their neighborhood. I was behind a guy, he threw a plate right out the window like it was a Frisbee. Another guy was pulling a trailer, junk falling off the back. Nobody cares. They don't care. But I care. I don't like it. And I get a lot of complaints about it.
Jeff, anything that you do, I'm supportive. Litter,
Thank you,
cops, all that. I mean.
Yeah, but the good news is there will 2 crews in each of our districts 1 day every week, in addition to what else we do.
Is Wes here? Where's Wes? Yeah, that's
He
fine.
may be dealing with the sinkhole.
Yeah, we had a pothole on Softly Field as well.
Oh, okay.
Yeah, so this is I just pulled it because I think it's great news for all of us in our districts, especially those areas where we've got people just throwing stuff out the windows because they don't care.
Oh, there he is.
Whataburger bags out the window.
Oh,
People don't care.
McDonald's bags.
Yeah,
Oh,
they don't
it's
care.
horrible, Tom.
But it doesn't look, it's not a good look for our community. So we got to fix it.
No, and Jeff, I'm very supportive. And when you brought up litter a couple months ago, I was all in. Wes, I just want to make sure that they're monitoring in some kind of way. We're measuring. I mean, that's a good, even if the administrator says we're going to put it back in the budget, well, let's put it back in the budget by measurement. And that's, to me, litter is an easy thing.
Yeah, we'll be able to
Yep.
quantify how many bags of trash, how many cubic yards of trash that we pick up.
Okay. Can we?
Absolutely.
And kind of give us a report on that.
Sure thing.
All right. Thanks, Wes. Thanks, Wes.
Thank you.
And I just said that, Madam Administrator, because, even putting it in the budget, we may need to put more, we may need to put less, but I'd love to monitor how much trash we're taking, because that's another thing too, Jeff, with our Tom Thumbs and our stores, and that's why you see 5 cents and, all type of taxes on businesses, because it's their litter. And so, there's a lot of aggressive plans in places that say Christine Clean, and so those are some of the things I'd love to have that discussion as we get some data and some measurements.
Sure, let's do it.
Thank you.
Commissioner Underhill?
Thank you, Mr. Chairman. I think it's important, I'm sure this will just pass as part without discussion tonight. So it's important to recognize that Wes has worked very closely with our incarcerated population to put 100% of our incarcerated population that is available for this kind of work is already working. So it's easy to say, well, we should just put all those prisoners to work. There are so many things that constrain an incarcerated person from being able to do this kind of work. We've got a lot of them out there doing it. We get a lot of great compliments from the citizens when the orange jumpsuit guys come out. But the bottom line is that the workload is greater than what we can accomplish with those. Madam Administrator, that is an accurate statement, right? 100% of our incarcerated population that is available for this kind of work is already at work doing it in the county.
Well, I mean, Chief Powell could give you specifics, but what I would say is the answer is yes, but remember, we can't force people, so they can.
Right, well, that's
yeah.
part of the availability.
Yes,
You know, as
okay, I
well
want to
as
make
the-
sure that we're not.
People oftentimes forget that when you're in jail, it's not that you're just sitting around. You actually are in preparation for court. Most of the people that are in our jail are preparing for court, and they have constraints, and they have rights to prepare for their trial. All those constraints mean that those citizens are not available for this kind of work. What I have found is almost every citizen who is available for this kind of work that's incarcerated wants to do it. And they do a good job doing it. So I just want to make sure that people understand that when we spend this money, it's not because we're too lazy to use the incarcerated population. We're already using the incarcerated population at 100% of its availability. This is adding on to that and not replacing it.
And Chief Powell.
It's an augment. This is, so I would assume that that Keep Pensacola Beautiful will use community service volunteers to some extent with their to augment their crews that they will have managing this.
Yeah, I think that's what they do use, because they do things like clean up the Maritime Park, and they'll come clean up fields. I know they do a lot for Michael Rose. But I think the 29 Doug is just for management. I think they do use those who have community service hours.
Yes.
I'm pretty sure that's what
Yeah.
the majority of their staff
Yeah.
is.
So hopefully as the courts get back open, maybe they'll also have folks that'll be able to be part of this.
So we had a number of them working in our neighborhood cleanups that we've done the last few weeks. Appreciate everyone being involved in that. I know the citizens really appreciated it. But Jeff, on the trash thing, I think some of it is, so I had an issue on North Point, and, you know, it was gloves, and so I wonder how much of it is when the dumpster services come and empty it,
Oh,
that
yeah.
things are flying out of the back of that. So I think it's some, I mean, they were boxes that, you know, I don't see somebody carrying a box halfway down the road and chunking it out the window, or, you know, so again, how much of it are those services? So hopefully those businesses that are doing that are taking the proper precautions to keep it within the thing.
And Jeff, if there's anything that we can do, and I didn't mean to cut you off, Mr. Chairman, if you're finished, if there's something that our PIO can do that doesn't cost us money, in a litter campaign, and a lot of our PIO, I mean, we talked about that. A lot of it is education and litter, and you know, quite frankly, you know, if you're driving down and someone throws a McDonald's bag out, I mean, and you video it, you can turn in your tag, and you know, that's a crime. I mean, so I think that we should at least do some type of litter campaign.
As a matter of fact, we have had people contact our lighthouse, like if they've been behind a truck, and then send us the tag. So we have had that. Unfortunately, it's typically ECUA or something where so we know how to get. They just need to tighten up the tarp.
Yeah, hopefully it's not one of our trucks.
Right.
Yeah. Well, I think we've had that before since I've been here on the interstate. So.
Chief Powell, can you maybe just, do you see it getting better with us being able to put road crews out? Or, I mean, because I know COVID has been.
Well, COVID isn't the issue, sir. What it is, as Commissioner Underhill spoke of, qualified, medically qualified, sentence qualified, charge qualified. There's so many variables before I can put an individual in one of these crews. The majority of our population, as you know, is pre-sentence. They haven't been in court yet. So for them to go to work, they have to volunteer. They have to sign a waiver to work. Sentenced inmates I can put to work, but usually the ones that are sentenced that don't volunteer are not the ones we want out there anyways, because they become
Do
problematic.
they get game time? Would they volunteer and work?
They get additional gain time.
Yeah.
Yes, sir. Yes, sir. We're getting, I mean, every benefit that we can provide to the individual, they receive for providing that service.
That's fine. While you're standing there, everyone that wants a vaccine for COVID in the jail has received it, correct?
Vaccine, sir?
Yeah.
Yeah, we're in the process right now. As a matter of fact, they're there today administering. We're not seeing the response that we expected as far as those desiring to take it. The numbers are minuscule, from my opinion. We're below 100 that have been vaccinated, but the majority of the inmates choose not to be vaccinated.
And what are we giving? Are they able to do the one shot?
No, we were planning for the one shot. It got pulled. We backed up. We had to replan. They're getting the Moderna. Matter of fact, they're in there today doing the second dose for the first group that went through 4 or 5 weeks ago, whatever that number was.
Yeah, and I think some of the other issue is because of the revolving door, right? That's
Yes,
why we
ma'am.
were hoping to do the one shot, because then we would be
Yeah.
guaranteed that
They
they
don't
would
have
be
to be there
protected.
28 days later.
Right.
But the
I mean,
ones that even get it when they're released, we're giving them instructions where to go to take the second shot if they
Perfect.
are released.
And I think, going back to a little bit of what Commissioner Underhill was mentioning, some of the things we've been talking about lately is that, there's a very large portion of our population right now that is, if found guilty and sentenced, would not be in our facility to serve their time. So
Yeah,
these
we're-
are people that would be going on, these are ultimately what we would see as state prisoners.
We run north of 80 percentile, or 80% that are potentially prison-bound, that they're facing felony charges, which they could receive a sentence that would qualify them to go to prison.
And some of those may not be eligible for, that
Well,
would
a
be a
very
large.
high number of
very
them are
high.
not eligible
So if we
for
think of
working.
80% of our population, either maybe not be eligible, but is not gonna be with us to serve their time,
Right.
I'm more concerned with that number and what it speaks for our community in terms of the violent crime and the types of crimes that are being committed. And, quite frankly, that's putting a huge burden on our county to take care of what is ultimately going to be state. And that includes healthcare and everything else. I know it's our responsibility until they're sentenced and state takes control over them, but that's, anyway, I was surprised to see that the number was that high.
When it's there's a little bit of glimmer of hope. We were as high as 83, I believe it was, a number that were already sentenced, waiting to go to the Department of Corrections. In the last few months, we're down in the 20s now. So we've started cycling a lot more into the Department of Corrections. We were holding steady for a long time of many inmates that.
Are we able to charge, do they pay us for those?
No.
So even though they're sentenced and they're supposed to come get them, they're putting the burden back on us. Maybe we send them a bill, just see what happens, and maybe it gets them moving.
I think I remember someone doing that.
I'm serious. Send them a bill and be like, listen, this is your responsibility. You should have come and got them. If you have issue with that, then, because, if
That's
we
like
were.
an unfunded mandate.
Well, if we were to have a housing agreement with them to where we housed them, they'd be paying us for that.
Right.
So, they're
Right,
supposed to be under
Mr.
their
Chairman,
control and
I'll
custody,
support you.
and.
No,
and
we
we're-
control, actually, they should close the front door. We transport to them.
I understand, I know, but they should have come and gotten them by that point, right? That's what you're saying, that it was up to 83 that should have been in their control and custody, but they hadn't
Yes.
accepted them yet.
Yes.
And so, again, they're pushing it back on us and forcing us to pay, so send them a bill, see if it gets.
Well, if we could just get them to pay for the inmate medical, I would take that.
Yeah, that's killing us.
That's the
Yeah.
killing us part.
Okay.
Mr. Chairman, we actually dodged a bit of a bullet this legislative session on that. There was a movement underway to close some of the state facilities, which would have exacerbated that problem. One of the things I think that luckily we dodged that bullet, that didn't happen, but I think it's imperative that the state understand the burden that they are putting on the counties by not properly taking care of that responsibility. So the discussion this cycle should not have been closing facilities. It should have been opening facilities. We know that our population in the state of Florida is growing. The state needs to be able to meet 100% of its requirement to incarcerate those that have been found guilty of those felonies. So while I don't necessarily think that sending a bill would be the appropriate thing, good drama to that, but certainly articulating this in a letter from this board and perhaps through fact talking and getting other boards of county commissioners to talk to their legislative bodies, or to their legislative delegations. The discussion they tried to have this year was the exact opposite of the discussion that they have to have. And the reason that they think they can do that is because we're not telling them the cost of their failure. The cost of their failure is that they're essentially pushing a state burden down to the counties that are the least able to fund to do it. What that will result in is the overpopulation of our jails. It will eventually result in the violation of the civil rights of those in those jails. Overpopulation is, anytime that you see something bad going on in a jail, it seems like overpopulation is one of those core things. So I would strongly support this board, sending that kind of correspondence to the state level, to the state legislators, and also using FAC, get other boards to do the same.
I'll be happy to carry that message as well.
So, and while you worry there, Chief, that is correct, right? 100% of our incarcerated population that is qualified to do that work and wants and is willing to do that work is out there doing the
Yes,
work.
sir.
Okay.
Yes, sir.
So nobody, we don't have anybody sitting idle because we haven't done our part. And I think that I want to, you mentioned you rattled off 4 criteria.
That's just one of 4 of many.
And we should recognize that those criteria are protective measures that ensure that dangerous people are not in our neighborhoods.
Very much so.
It's because of those protective measures that all the phone calls I get about those crews are positive.
Thank you.
Because you're only putting people in the neighborhoods that can get the work done and do not present a risk to the neighborhood. So I don't want any of this dialogue to be perceived as we should we should try to get more out there by lowering the standard. That standard should be very high.
It is, sir.
You know, because those crews are what, 6-to-1 to the CO?
Pretty much so. I mean,
No.
and even less than that because of COVID.
If you've ever tried to watch 2 kids, that's hard. If you've had to try to keep your eye on 6 adult workers, that's serious work.
I think
And so we want to make sure that those workers are partners in what we're trying to accomplish. They're not people that would, become a flight risk.
I think we had about 3 or 4 for all the crews that were doing the neighborhood cleanups.
We're down to that. Yes,
Yeah,
sir.
3 or 4, so.
Thanks.
Maybe closer
Yes,
to
sir.
3. 19 and 20 are dirt road paving projects. 21 concerning reallocation of capital improvement program funds for Jeff. Yep. 22, recommendation concerning the lease agreement between Escambia County and Pregnancy Resource Center DBA Life Options Clinic. 23, recommendation concerning the purchase order issues of emergency power electrical reliability assessment. 24 is a discretionary fund for movie nights over in Scenic Heights for me. 25, recommendation concerning approval of expense through the CARES Act funding program.
Yes, and I just want to make sure if there were any questions related to the letter C. And I know that I've discussed it with each of you, but I want to make sure whether or not you have questions.
That would be the emergency mail service loss of revenue due to COVID in the amount of $2 million. And part of that stems from Medicare, Medicaid not getting some
And some-
cash to us.
Yes.
So, Madam Administrator, I see on B on 25, I know we've been, the $10,000 that we're doing to the Bay Center, is that just out of CARES Act money, or was that included in the money that we allocated to them?
No, this is just separate. They were going to do some maintenance. It was going to cost a lot more. So Cassie and her team were able to look at it and get it reduced down to the 10,000. So it does help with some of the air handling and things that we discussed before, with the Bay Center.
All right, and maybe we can talk offline, but I
Okay.
think some of those things, even at Brownsville, some of the humidifiers and some of the spray and some of those things that have been implemented, as much as we've been utilizing that for testing, some of that stuff needs to be done at Brownsville.
Okay,
and that should
okay.
come out of CARES
All
Act.
right.
And
26 is District 5 discretionary funds. My add-on, which would be number 27, is discretionary funds for NISI.
Okay, good.
How much are you doing? I'm doing 1,000.
I'd like to go ahead and join you. Okay. I'm going to piggyback and do 1,000 as well.
That's
Amend
for
20
NISI?
Yeah, for NISI.
27 will be uploaded later today, and we'll add Commissioner Burgash for the same amount. Thank you, Commissioner Burgash. CAR 3 for discussion, recommendation concerning the acquisition of real property located at 1640 Diego Circle. 2, concerning 2021 legislative session review.
Did you want to have Zanani go on and make that presentation this morning? It's like 4 slides. Or she could
I'd
do
rather
this
have it
evening.
this morning than tonight.
You have to
Yeah, I've
leave?
got,
Okay.
So, 3, recommendation concerning.
So we're gonna do it tonight?
Tonight,
do it
sounds like
tonight.
tonight.
Yeah.
Okay.
Recommendation concerning interfacility transfers utilizing Escambia County ambulances, Commissioner Underhill.
Out of respect for Jeff's time, because I know you've got a hard stop, right? This is, I mean, and I know this is something that I really actually want to talk with you particularly about this, because I know that you've got thoughts on it. So we can just have that conversation tonight, and I will do my best to make it short. I just want to present some data that I found in the research. As we,
This is important.
So, one of the common talking points is EMS is holding calls again. Okay, and that's true. It happens way too often that EMS is holding calls, and by that, but I mean, they're not able to respond
1075.
to a 911 call in the way that they're expected to. So I asked for staff to give me some information as to why. What are the things, what's the cascade to failure that results in the holding of calls? And a couple of things that came up that I was not aware of, so I wanted to be able to share with the board and enter into the public discussion, is the amount of our ambulance rides that are actually inter-facility transfers. Now, I know that a lot of folks up here are very small government kind of oriented folks. So, my question number one is, what problem are you trying to solve? Question number two in my problem resolution is this the government's job? The government's job, in my perception with regard to EMS, the government's job is to get to you at your home or at the place of an injury and get you to first care. Once that is done, we've kind of met our obligation, the obligation of the public sector. What we're doing now with transferring from inter-facility, while I think it might be financially beneficial because those get paid out at a higher rate, I think, so it may look better on the books. We're transferring, that's not really fundamentally a government job in that they're already in the care of the medical system. Right. So transferring them within the medical system probably should not be our job. And when you actually look at, and this is information, and Eric, I don't know if you gave this information, if you sent this as well to other commissioners, but this is as of April 26th, so before, even a couple weeks ago. Mm-hmm. Out of just 2 facilities that we do interagency transfers, out of the Perdido Bay, right there on our 425 ambulance rides out of there.
Oh, yeah.
For the year of April. So you're talking 3 and 4 a day.
Yeah.
Tying
Plus
up our
the
ambulances.
helicopters too, or does that include the helicopter?
That does not include helicopters. That's just what we put in a box.
Yep.
Yeah.
So Navy Urgent Care at 119, I think, is the number 2 facility. So PBER is a huge outlier at 425. Mm-hmm. But then the other data artifact that came out of that discussion was instances in which EMS arrives at a hospital with somebody in the box.
And they don't release them.
And they don't have a bed for them.
Yeah, and so they're waiting. That's got to end.
Yeah, so there's 390 incidences where EMS unit year to date has had to wait 15 minutes or more for a hospital bed. I was under the impression
they dropped them off.
If you're flying through traffic with the lights on, that you get somewhere and you've got like you see on TV, right? You come right out of the box and into the ER. We have ambulances sitting, and of course that ambulance has to be cleaned once the citizen comes out of the ambulance. So we have them sitting a lot. Because of some inefficiencies there. So, and that's not an indictment on the hospitals. It's just that's an area, so instead of just continually saying EMS is holding again, why and where? And so the poor item as I put it on the agenda was, is it really, could we simply get out of the business of interfacility transfers? And I don't know what the financial impact of that would be, but by transferring that out to the private sector, and letting the private sector take care of that so that we can focus on the public sector responsibility of responding to you in a timely and efficient fashion when you hit 911.
No, man, and I will say, Doug, there's a lot of things we don't agree on, but I do agree with you on that to a point. The only thing where I would step in and maybe have an issue is if it's going to negatively impact our revenue. But it appears in speaking with Director Gilmore that we've got an equitable fee arrangement that we're working on with West Florida Hospital.
Well, we're working on we're working with those guys to lease our equipment to them and have their personnel ride the box.
Absolutely.
So
Absolutely.
There's a lot of discussion that has happened since you and I, and since I give you the stuff.
Now let's talk money though, because in talking about what Commissioner Underhill was just saying, I mean, we provide a lot of transfers for citizens, and a large number of those we never get paid for.
Right.
We do get paid from private insurance, Medicare, TRICARE, but a lot of folks ride the ambulances multiple times and never pay, not a dime, none. Right. So unfortunately, when we talk about using the transfers, in the past, that's been a revenue source. What do we get for a transfer from the hospital, from West Florida to West Florida?
It's $800.
$800 bucks. $800 is not an insignificant number. If I get in a wreck on the side of the road, I know my insurance is charged $600. How much is it?
Yes, $600 for the ride.
So the transfers actually make us money, Doug. So we got to be very careful how we slice this. I mean, we don't want to cut off our nose to spite our face. And I mean that's a revenue source. So whatever we do, we don't want to hurt our revenue.
I agree with you. But So we're going to do, we're talking to them about leasing our equipment to them for their personnel to ride the patient into town. So we'll get lease agreements there. It'd be a one-year contract, COPCN, that they'll have the availability to do that. We're still negotiating, we're talking these things out. This is just preliminarily.
So those 400 rides that he talked about at $800 a pop, that has got to positively impact our bottom line because they do pay.
It does. They do pay. It's guaranteed money. That's the downside of it is guaranteed money.
Yeah.
With the caveat of that, we haven't had our rate fees increase since 2011.
That's got to change. We have got
I am bringing a proposed rate fee increase to you guys for recommendation. It should come out the next board meeting.
Yeah.
And we've got it justified with what Okaloosa and our counterparts in the Panhandle are doing. We're low, obviously.
Yeah.
So we are going to ask for a rate increase to try to help generate and offset that as well.
So Doug, while I don't necessarily disagree with you, I mean, I don't want to bring up a solution to a problem that costs us revenue. We got to make smart decisions. So I trust Eric to negotiate something that's not going to result in any revenue loss.
So we've had a lot of positive things happen. So on the hospital call this past week, I addressed it with the hospitals about holding at the hospitals. So the hospitals agreed to go on bypass if they're holding beds. That way to let us know not to waste our time to go there and try to drop off to keep from holding calls. So we're going to start doing that, watching the hospital bypasses to make sure that we're not holding at a hospital. Working with a lease agreement with West Florida and Perdita Bay with our equipment to see how that goes, and we'll figure that out. They're also implementing the helipad that they're trying to get in place real quick. That'll cut down on our fire response and our need for 2 trucks to go out there and babysit the road while a helicopter's landing. And so we're working on those things. So and trying to, of course, always increasing our staffing levels, our EMTs and paramedics to get more trucks on the road is our optimal goal to hopefully get around this.
Outstanding. So, Mr. Chairman, and the reason that I wanted to have the discussion is to recognize that, while the first is the worst, we oftentimes say in the Navy, the first report is the worst. Oh, they're holding calls. The reality is that there's an enormous amount of work taking place to solve the problems that exist. And as I've done the research on it as well, communities like ours are suffering this writ large. And so it's not an outlier, but the solutions, and I want to, I think that somebody's head's going to explode if we keep agreeing on things. But the fiscal aspect of it is important as well. So we need to make sure that we are staying fiscally responsible, but also that when you hit 911 in this community, someone shows up. And so what we've done now is, because we're doing the thing that's most, we're doing a lot of what is most financially rewarding, we are decreasing the level of service and readiness that we have for the citizen in their time of need. Now, they work Herculean efforts to make sure that they drop whatever's necessary, and they prioritize and triage.
And that's what I want. Thank you for hitting that topic. So 911 call is a priority call. A transfer is not. They're already in hospital care, under physician's care, under nurses. Yes. If we do prioritization, if we say we do get a box freed up and they're wanting a transfer out of Perdita Bay, and we start sending that truck that way, but we get a cardiac arrest, that truck is now diverted again. Yep. So they'll hold the call at Perdita Bay as long as we're doing 911. That is our priority, is 911 to the citizens. We don't want anybody's family member that needs help is not getting it. Absolutely.
But for the half of that trip that you've got somebody in the back,
yes,
you can't just drop them off at the next.
No, I can't. We can't do that. So
there is a burden that we're putting on you that does result in not
knowing what the next call is going to be and
exactly.
how. So we try to make sure we have available units. We have units freed up. That way, if that does happen, we don't take our one box. We are working that. Dispatch is doing a fantastic job. I got to tell you, our paramedics and EMTs, we're over 15,000 calls, 15,000 runs this year with people in the back of the box. That's up 517 this time last year during the height of COVID.
Yep.
So our manpower is taxed, and our staff they're doing an incredible job of managing this and working with dispatch. It gets heated a little bit between the two divisions because one knows better than the other, but we're working things out, and things are, we're making it happen right now. So with the rate increase, with the help of the helipad, to release some pressure there, with the lease agreement possibly, and the hospitals going on bypass, let us know not to waste our time trying to go drop off at their ED, those things should help us out.
So we often say that, how do you eat an elephant one bite at a time? You've just rattled off about 4 or 5 bites.
Right.
that is, quite frankly, Eric, that's the trade craft of your job, man. So I know that part of the discussion has not been put out publicly. There's yeoman's work going on behind the scenes that
I
you're working
appreciate this
on,
opportunity
and
to put
so
that out.
I wanted to take this opportunity
Thank
to
you.
get that out. And then also, let the commissioners, as we start thinking about those interagency, interfacility transfers, having to measure quality of service or availability and the financial soundness, because I don't have it in the backup here, but I know that there's a graph going around. I was always under the impression that EMS was cash positive and self-sufficient. We now know that not to be entirely accurate. Now, a lot of that has to do with transfers going out, but now that we're starting to see more of that data, I think that we are in a position to make more educated decisions and educated discussions up here. So that was the purpose for this. So if that scratches everybody's itch this morning, then we can breeze past it
So I'll just make a
tomorrow.
couple, so of course, that's why we've seen where people, and I've experienced it firsthand, where I had a family member at a facility that was waiting on a transfer that waited for a few hours because the higher priority call is going to take precedent. But also, I was going to say, Eric did mention that on our call on Monday, and we're working with them. We've been working on this for a while.
Yes.
I mean, it's been a discussion for a while. And so in terms of going back to the funding, if Medicare, Medicaid stops making payments, which is what they've
That did happen,
done.
and they're starting to pay out again, but we're behind because of that, so.
In what I was doing before with insurance, I mean, there are doctors that have to take out line of credits and loans to pay their bills until Medicare, Medicaid pays. I mean, this is what they do. And I think, Doug, you said there's always a reason behind it. Some of the things we put out, I think a couple weeks ago, we put out know when to call 911 for an emergency.
We're going to hit that hard again. I got working with Laura to put that message out again,
And
yes.
so I know there were some people that were critical of that, but they don't know about the calls that we've taken where someone, couldn't get to their phone charger.
Couldn't get to the phone
They called
charger.
911, get an ambulance because they couldn't reach their phone charger. They weren't trying to go anywhere. They didn't need medical help. They needed their phone charger. Or they just need a ride to the doctor's office.
All right, we've had them sit ready to go right to the doctor's office. We've actually had them ride to Sacred Heart Hospital, refuse at the hospital, and walk across the road to the mall. We've had that happen, so.
So, I mean, talk about putting a burden on the system. I mean, that's.
Well, much like our litter discussion, we can do things from this dais to solve or to fix the result of the problem. But the problem, oftentimes, there is a citizen responsibility element to it. So I've talked to Dr. Edler at length about some of the times when she's just said, no, that person is not getting in the ambulance. That's the right thing to do. It's not the popular thing to do. And there's high risk in that, right? Because
There
then
is.
if that person does end up having a medical emergency and you refuse care, but there's high risk in just saying yes to everything as well. And the risk that it's causing is that that is a part of, again, that cascade to failure, those building blocks that build a wall between us and good business practice. We've got to figure out how to re-educate the citizens on what a proper use of our EMS is. Because when they use it and they don't need it, they are taking it away from somebody who does need it.
Absolutely.
And the only thing I would say is we have talked very clearly about making sure that we have a know when to call public campaign so that we aren't having those calls.
Yeah, we're trying to hit that really hard to make,
Yeah.
to educate this education piece, so. I thank you for the opportunity to put this
Sure.
out there. Thank you, sir.
So this satisfies that discussion, you believe so? Okay. Okay. County Attorney's Report.
There are 3 items on tonight's county attorney's report. The first item is concerning naming rights for 2 county facilities. Commissioner Berry, do you wish to address that? Number 2 is settling an administrative claim in a case brought by Carol Reese. And the third item is scheduling a purchasing code amendment coming out of the board's discussion at the last board meeting. I can answer any questions now or during the day today.
Okay, anything else for the good of the whole? See you guys at 4:30 for public forum.